When will you and your family be able to get the vaccine? You may be wondering. Well, California's first shipment of vaccine includes 327,000 doses. Essential workers and those most at risk are getting sick will follow healthcare workers and those in long-term care facilities. But beyond those groups, the state has not yet determined who will be next in line for the vaccines. And joining us this morning to talk about the vaccination timeline and some of the safety concerns is clinical nurse Alice Benjamin. Good morning.
Good morning, everyone.
So, Nurse Alice, we want to thank you again for being with us this morning. You know, now that the FDA is headed towards approving this vaccine, what happens next? What's next in this process?
Well, I think, a lot of information is coming pretty rapidly. I mean, you have healthcare professionals who are also bringing themselves up to speed with the vaccine. So once we have the FDA approval, we need to clarify the plans. What is the rollout going to look like? And again, making sure that we get the vaccine to the healthcare professionals and to people in the long-term care facilities. But I think a real important piece is that we're going to need to educate the public, because although this is great news that there is a vaccine that will soon be available, it's only still just a piece of the puzzle. I mean, just like anyone who has diabetes or hypertension, you may have medication to take, but you still have to continue to do the other things. You'll still need to wear your mask. You'll still need to social distance. We'll still need to limit activity and do all those things as we work on a plan to try to get more and more people immunized. And even that's going to be a challenge because, it's coming really fast. Many people are skeptical. So again, education is going to be very important in this.
Nurse Alice, I want to talk about, just talking to some people out there. This is all a new virus. This is a new vaccine. Can you talk to us about some concerns that experts have over the side effects from this vaccine?
Right. So whenever, the creation of a vaccine usually takes a very long period of time, sometimes 7 to 10 years. It's presented to the FDA for approval with, usually at least 6 months, if not 2 years of post data after they've received the vaccine. They follow these folks so they can get all of the information about side effects and things like that. And so what was presented was 2 months of post-vaccine data. And some of the side effects that were most prevalent were fatigue, headache, muscle pain, chills, joint pain, and fever. And sometimes very intense for the following day. So, people are concerned that we don't have as much data as we'd like. They're concerned about some of these side effects, as many people have said. These seem like the side effects of actually having coronavirus, which, can also be scary. But it's the fact that it's new, it's coming very quickly, and we haven't had the opportunity to do a full educational rollout. We want people to be able to really understand and know this vaccine, just like we'd expect for them to know their other medications that they're taking. So I think people are just skeptical because it's happened so fast. The stakes are high, lots of people are dying, and it's like we're backed up in a corner here. So people just want to survive and get through this, and we want to get back to normal life.
Nurse Alice, you kind of touched on it. There's a lot of misconceptions, and we've talked to you about this, that people think, look, the vaccine's here. Once it's widely distributed, the pandemic will be over overnight. We know that's not the case. You kind of alluded to it. We will still need to wear masks, still keep our distance. Why is that the case?
Absolutely. So it's estimated that we need at least 70 to 90% of the U.S. population to have this vaccine in order to acquire herd immunity. Now, that's going to be a challenge because even with our flu vaccine, which we've had for a while, even just these past years, the highest we've ever gotten was 52% of our population getting that vaccine. So now to have this newer vaccine, something coming very quickly, again, stakes are high. To get, people vaccinated more than what we've done with the flu vaccine is going to be a challenge. So it's going to be critical. Even if you get the COVID vaccine, you're still going to need to wear your mask. You're going to still need to social distance, because I think the misconception is people think that if I get the vaccine, I'm going to be okay. Well, we hope that's the case. We still do not know how long any immunity will be acquired from the vaccine. And even if you do get the vaccine, you still may be a carrier and spread it to someone else. So there's still a lot of things that are unfolding that we're learning more about. That's going to be a challenge to get as many people vaccinated. But the key to that is going to be to educate people and continue to learn more. So Pfizer will continue to share information. They'll continue to do studies, especially as we're looking at who can get it and who can't. For example, it's really, for kids under 16, they're not really a candidate for this quite yet. Pregnant women who are breastfeeding, and people who are severely immunocompromised, not quite the candidates who we're going to give this to first round. So we still need to do some studies to make sure it's really safe for the general population.
Nurse Alice Benjamin, thank you very much for joining us this morning and all that insight.
Thank you.